my favorite patients, if you will, are the pregnant and postpartum. And I think that's even more so now that I can relate to that. Going
Mhm.
through my first pregnancy, my son's now 10 and a half months old, and
Mhm.
going through postpartum, I was honestly shocked at how difficult it was to rehabilitate my body. And I'm still working on it. Like it's a long healing process.
Mm.
And going through it, I mean, I kept telling my mom, my sister, when I would talk on the phone, like, how do people do this that have no knowledge of
Probably doesn't get
what to
done.
do? Yeah, and their body and what's normal.
Welcome to Mindset Mastery Podcast, where we explore the intersections of motherhood and entrepreneurship. I'm your host, Julissa Edwards, and in each episode, we're diving into mindset, emotional regulation, and the real stories of mom entrepreneurs navigating both business and family life. Let's get into it. Hello, hello, and welcome back to another episode on Mindset Mastery with yours truly, Julissa Edwards. Today, I have the honor of interviewing a friend and neighbor, Dr. Caitlyn Flores. She is a pelvic health physical therapist specializing in pregnancy and postpartum rehab. She is dedicated to making pelvic PT more accessible for busy women by offering both online and in-home services. This interview was so wholesome. Um, Caitlin is a postpartum mama to a beautiful 10-month-old baby boy. And once she educates us severely, it was so well in this episode about all the things that mamas and women should be looking out for in terms of their pelvic health, prenatal, postpartum, during pregnancy. It was just so abundantly informational in that matter. And also, she shares with us how she is sharing her or beginning her journey of entrepreneurship. Um, yeah, as a new mama and what that means for her and her family and all the challenges that come with that, or just the honesty that comes with that. So it was a beautiful episode, beautiful for women and mamas who are looking to learn more about their pelvic health. And then also for any mama who is thinking about becoming a business owner, that too, this episode will be very, very informative for you. So without further ado, please enjoy and let us know what you think about the episode. Thanks for listening. Caitlin, how are you, girly? How are you feeling?
I'm great and happy Valentine's Day.
Happy Valentine's
Yeah.
Day. Yes. All right, girly, we're gonna dive right in. What made you choose the field that you're in? Tell us a bit about your background, what inspired you to specialize in pelvic health, physical therapy, and why you chose to focus on pregnancy and postpartum rehab.
So I knew I wanted to be a PT back in even high school. But then once I was actually in a physical therapy program at UTC, we had a pelvic floor physical therapist actually come and speak to us and bring a live patient. And that was very unique experience to have, and a very brave mama that volunteered. She had had 4 babies in 4 years and was suffering from diastasis recti, which, if you guys don't know, is when the abdominals have some separation, which can contribute to a lot of issues, whether it be bowel, bladder, or sexual health problems.
Mm.
And so she was showing us live some of the exercises and treatment techniques that she might use to help this patient. And she was also a patient success story because she was pretty far along in her care. And I just remember, one, being terrified at
Mhm.
hearing what she had gone through
What
and
can
thinking, oh my
happen?
gosh, is this rare? Is this going to happen to me one day when I have babies?
Okay.
And secondly, um, just being so grateful that people like this therapist existed, that could help her, because uh, one, two of us are female and a lot of us have babies. So birth
Yeah.
injuries are very prevalent. And then in school, I knew I wanted to do it. I really tried to advocate actually for our program to get a course added on pelvic floor, but we needed a show of 7 hands and only 6 people raised their hand. And I was super bummed. And I thought, okay, well, I'm just going to have to get continuing education on my own. And so I started in school before I even graduated, going to a course in Atlanta, and then went in El Paso and Charlotte, and once I was into my career. But my first job that I took, I purposely took at a facility where there were 8 women that were practicing pelvic floor PT, because I knew I wanted that mentorship, and there's only so much you can gain from courses.
Sure.
So I got amazing mentorship and training in San Antonio at my first job. And it was there that I started seeing a combination of orthopedic and pelvic patients. And it was just addicting. Like every patient that I saw, I loved it more. It fed my appetite to learn more, to research more, to read more. Half of the books that I read are probably nonfiction and involving women's health.
Oh my
So
God, I can so relate. So
yeah,
funny.
yeah, exactly. If you love what you do, that's probably
Yes.
what you're also reading during your free time.
Yes.
So yeah, I started treating just females initially, and I actually did treat males as well, specifically post prostatectomy. But my passion, my favorite patients, if you will, are the pregnant and postpartum. And I think that's even more so now that I can relate to that. Going
Mhm.
through my first pregnancy, my son's now 10 and a half months old, and
Mhm.
going through postpartum, I was honestly shocked at how difficult it was to rehabilitate my body. And I'm still working on it. Like it's a long healing process.
Mm.
And going through it, I mean, I kept telling my mom, my sister, when I would talk on the phone, like, how do people do this that have no knowledge of
Probably doesn't get
what to
done.
do? Yeah, and their body and what's normal, because it felt like just
Mm.
this uphill battle that I was having to go through. And I mean,
Can you
everybody that's
tell
had a
us
baby, you get it.
Yeah, can you tell us more? Because I feel that um m many women just probably just aren't even aware of what they're battling. So what are
Yes.
you currently facing as a mama who's 10 months postpartum? What are the struggles that you're facing to get your body back to where you'd like it to be?
Yeah, so I think one thing, I used to be a runner. I've run a couple marathons and half marathons. And what I was so surprised by was how difficult it was to get back to running and jumping without feeling that urgency or feeling like, oh my gosh, I might leak if I keep going. And I,
Mm.
gradually progressed. I remember, so initially just a lot of rib pain, a lot of pelvic pressure heaviness, which after a vaginal birth is
Mm.
very typical. But it's not uncommon for people to get some degree of prolapse because of pushing. And I definitely feel like that was my struggle initially, and just trying to increase my active support with my muscles to prevent me from feeling those symptoms when I'm on my feet for a long time or running or, yeah,
Mm.
jumping. That has been my biggest battle. And then just um, constipation with the hormonal changes of
Mm.
breastfeeding. I never had to take
Mm.
fiber chews or do any of these things, but just, yeah, having to actually go through what I help my patients walk through was really humbling. And I think it made me a better therapist in the sense of I dug deeper, I know more, but also I have
Yes.
more empathy for what they're
Yeah.
going through. So
Yeah.
that's the,
Okay, so we have this is my thoughts are kind of sporadic. That's how my brain goes. So I'm gonna like touch different things that you said.
yeah,
We have a lot in common because so as you've already heard, Caitlyn is a mama to a 10-month-old baby boy. So cute. His name is Gabriel.
yes,
And he's the cutest. And yeah, so you're like fresh. You are fresh into the postpartum world, new mama world. And now you're also exploring and venturing into entrepreneurship, right? And
yeah.
so I mention all that because your passion for this field was sparked at, when you were in school and you did so much to dive more and more into it. And I think it's really, I mentor so many mamas that are looking to go into business, and sometimes they know exactly what they want to do, and sometimes it takes some researching, right?
Mhm.
Everyone's story is different. I think our paths are a little bit similar. We went to school for this. We worked in a hospital or clinic or for somebody
Uh-huh.
else, and then we said, you know what? I want to do this for myself.
Mhm.
And I think in your case, similar to mine, correct me if I'm wrong, there's so much passion that is involved there. For example, I too, when I was learning about trauma, anxiety, depression in school and
Mhm.
grad school, I mean, I found it so fascinating and I loved it. And I always loved the psyche and learning more about, mental health and psychology and genetics and how that all plays a part and culture and everything. And then I experienced it, particularly during I had prenatal depression,
Mhm.
right? And that was my first big, like, whoa, like I have never felt this before. Of course, I've counseled so many patients through their own depressions, but it was a completely different experience for me. And so, yes, gaining more empathy and then also just kind of like falling, even though that was so hard, falling more and more in love with what I do and the knowledge that I have in this arena, which I feel like you can probably relate to.
Yeah, for sure. I knew that I wanted to do this. So it wasn't a question of what would my business be, but more so, yeah, how will I go about starting it and how can I still be present for my family and my child as much as possible. So
Right.
maximizing, yeah, the amount of time that I have with my family, um, but still being able to provide the type of care that I want. And I'm
Mm,
sure you know this from working in either hospital or clinic-based healthcare facility.
yeah.
It starts to be this game of how can we work you as hard as we can, give you as
Yep.
many patients as we can, and
Yep.
this tiny amount of time, like this time that we're crunching, like you no
Yes.
longer have charting time, or now your lunches are 30 minutes and they're not 60, or now, which this was the biggest thing for me that made me want to go into my own career path with entrepreneurship was seeing two patients at once, sometimes three.
Wow.
Yes.
Well, I
And
didn't
that
even
is
do that.
very, and if anybody listening has ever gone through physical therapy, they're probably like, yeah, that's
Oh,
normal.
well, that is common. Yeah, I'm like thinking
Yeah,
about, yeah, yeah,
because
yeah.
of the gym
Mhm.
setting. And so
Yeah.
all of my evaluations would be done in private. And I would feel like
Mm,
I guess I'm promising something that I'm about to not deliver, and that eats at me because they
mm,
feel like, okay, this is a private, safe space, but then I have to tell them, well, this session is like this, but most of our sessions will be in a gym. And if someone cancels, they're alone.
mm,
But if they don't cancel, I'm doubled. And I'm literally having to take
mm,
someone back into a private room. Someone, a tech or another assistant, is working with my other patient in the gym and I'm not able to monitor their form and their technique and I'm a perfectionist. So
mm,
I don't do well with giving that over to someone else. And
mm,
I'm the only one in all of in the last two clinics that I worked in that had training in pelvic health.
mm,
So they're asking me to train someone that just graduated high school that's interested in maybe becoming a PT one day, but has had no coursework to monitor my patients. And I just
mm.
have a lot of like ethical dilemma with that.
Yeah, yeah,
And
yeah.
so another part would be insurance limitations. Patients,
Yes.
maybe I see that they're probably going to benefit, I'm estimating maybe 12 sessions, and
Mm-hmm.
insurance says no, they can only have six. And
6.
so
Yeah, that's
then
like the magic
that's the
number,
lovely
even in mental
number.
health. Yes.
Yes. And then I have to make an appeal on my lunch break, phone call, paperwork, or staying after hours, emailing. And then they're like, okay, you can have two more. And it's like, okay.
Interesting though. So you even working in a clinic had to do your own paperwork because when I was working in
Mhm.
a mental health clinic and or hospital or somebody else's practice, the insurance piece was always handled by somebody else. So you had to do
Uh,
that yourself as well.
so most of it is handled by the front desk in the clinics. However, there's just certain paperwork like writing the coding and the diagnostics and their outcome measures and
Oh, like your notes, like your
yeah, like
QT.
my
Yeah.
notes. I just
Yeah,
need to
yeah.
like transcribe my notes onto the forms And
Mm.
sometimes, you get called by whether
Mm.
it's work comp or an insurance company, and you have to explain why the
Why they deserve
patient
to be there.
needs you and if they're getting better. So
Yeah, yeah, yeah,
those
yeah.
phone calls
Yeah.
happen probably more
Yes.
often than paperwork.
Interesting. Okay, so I told you I'm gonna flip flop. So,
Mhm.
yeah, so many similarities there, and it just shows your passion for the field. And yeah, like you're worried about the ethics. Catch 2020, right? Because me personally, I'm someone who used to thrive in environments like that. Like, while I didn't enjoy it per se, I did have this for me, like an internal competition of like, wow, this sucks, but I'm still going to be the best at this. And I'm going to
Yeah.
have like octopus arms and do all the things, even though I'm being stretched
Uh-huh.
so thin, right? Because in that environment, like, I mean, humans are created to survive. And so we adapt, whether it's healthy or not.
Yeah.
And we try to be the best. And yes, in healthcare, you end up doing just so much.
And they
Um,
incentivize it. I mean, you can get more bonuses, you get paid
yes,
better. Like, so
leadership
100%, I know what you
positions.
mean.
Yeah, yeah. And so I remember when I had some fears when I took the leap into entrepreneurship because the whole point was to spend time with your family, to have more of a
Hmm.
life, a more of a work-life balance. And I used to tell my mentor, like, I went from seeing 40 clients a week to then eventually seeing like 8 to 10. And I was like, while this is amazing, I fear that I'm losing my grip
Mm.
on my clinical practice because I'm
Yeah.
seeing so much less than
Right.
I'm used to. And that was a big shift for me. Um and it I'm not gonna lie, it made me insecure a lot of times in my entrepreneurship journey of like before CEU's continuing education credits, like it was like a hassle. It was like, oh, I gotta do this thing. But it's like I'm practicing people all the time. Like I don't need any more information. Like I know my stuff. Like,
Right. Right.
versus
Right.
now where it's like, I almost feel like no, this is very, very necessary so that I
Yeah.
stay on top of like what's current in the field of mental health.
Right. I can see how that would happen because that is a fear of mine as well. Like I get so much practice from seeing about 48 patients a week when I was full time
Yeah,
to going down to, yeah, just seeing a few and working like probably 10 hours a week, 10 to
yeah,
20. And with, yeah, being more part-time, you do get less practice because it's less patients, and
yeah.
you might only be exposed to the type of patient that is drawn to you and the type of patient that you
That you're
are
drawn to.
that you are
Yeah,
drawn to.
yeah.
Exactly. Which,
Mm-hmm.
like I said, is the pregnant and postpartum
Yeah.
populations.
Yeah.
So yeah, my male post prostatectomy skills are going to get a little bit rusty,
And
and
that's
and I'm,
okay.
yeah, and that's okay.
Yeah.
But I think especially because in this city that we live in, um, to my knowledge, I was the only pelvic PT working in an outpatient setting that accepted insurance.
Mm.
So if I'm not there, where are they going? Is what I,
Yeah.
and it was the same thing in Tucson. I had patients driving from near the Mexico border to come see me. I mean, in
Mm.
San Antonio, I had patients coming from 2.5 hours south Texas to drive to
Mm.
see me because they were like, "What? There's help at this hospital now. I don't
Mm.
want to deal with using 10 pads a day for my incontinence anymore. I'll drive 2.5 hours once a week for 8 weeks."
Two and a
And
half hours. Wow. Yeah.
yes, and
Yeah.
so that's kind of what I've witnessed. I mean, when I started working in Tucson and then here in Somerville, I brought pelvic PT to that clinic. So it wasn't there before. So when I leave, it's not there
Mm.
anymore. And I just feel,
Mm.
yeah, a lot of pressure because when I'm working, there's like 50 people on a wait list to come see me. I'm
Oh,
booked months.
wow.
Yeah.
Oh, I didn't know that there weren't that like that position is scarce.
Yes. It's rare,
Interesting.
and there are more cash pay clinics, but
Mm-hmm.
insurance accepting far more rare now.
Mm.
Because if you practice somewhere where they accept insurance, they have these stipulations on doubling and tripling you with patients that really shouldn't be. And so I think more and more of us that are practicing pelvic floor physical therapy are like, no, this isn't great care. We need to
Right.
go about it on our own.
Yeah. We all have our own journey. And what I wanted to mention too before is that, yes, like we're seeing less patients now going on the road of entrepreneurship, but our care is so much better.
Right.
We have so much more bandwidth for everything that comes with being a clinician,
Hmm.
right? And so it's a beautiful thing. I want to track back just a little bit to the beginning of our conversation, just to give mamas. I'm trying to get all spectrums here because you're a mama that's new in business. For
Hmm.
anyone that was contemplating, like, can I do this? If you have a field that you're already in that you're passionate about, I think the transition is pretty seamless. You're doing the
Yeah.
same thing just for yourself. You
Right.
already know how to do all the things. You've been trained by professionals to do what you do. You have your degree. Like for me, it's a seamless transition. It takes
Yeah.
courage, but like you have the skill sets, you have the degree. And so my other question is, so you were saying earlier that you were having a hard time, getting back to your normal self. And like I know for me, I don't think I had we've shared this in private, but for those listening, I had a traditional hospital birth with my firstborn son, and then I had a home birth with my daughter. And she was a 12-pound baby. So, and I had the kids back to back there, 14 months apart. So I remember my midwife, who was a nurse practitioner, she advised me heavily to go into PT afterwards because of
Mm-hmm.
my pelvic floor health,
Mm-hmm.
right? And like bladder issues and things of that sort. So luckily I kind of already had an upper hand from her to know to do that afterwards. But I remember yeah, I think those sessions were like 200 a session, and
Yeah.
my insurance only covered so much. So I was paying like a good hundred a session.
Right.
But anyway, it was super helpful. And I don't know how many women are advised to do that, and I don't know
Right.
if they know what to expect. Like my personal experience, beginning early postpartum, like I remember not feeling balanced when walking, right? Like I
Mm-hmm.
remember my like almost not waddling, but like feeling like the earth underneath me was not settled. I just didn't
Yes,
feel
no,
grounded.
I had that feeling of like I would walk with the stroller and I felt like I was almost like drunk. I couldn't walk straight.
Yes,
It was
yes.
strange.
Yes,
Yeah.
like that feeling. Yes.
Yeah.
And then, within due time that went away. I did a lot of like postpartum yoga and stuff like that to kind of like get my core back in shape.
Mhm.
But what I really struggled with was my confidence in like things like jumping
Yeah.
or running, like because I had a baby and then I had a toddler who was ready to play and run and do all the things. And
Right.
even after I waited, like, the 6 months checkup, make sure everything is good,
Yeah.
all that's panned out well for me, thankfully. But running was such a it felt like I couldn't separate my if I separated my legs too much in a stride, it would hurt.
Yeah.
And it would feel simply unsafe. And
Right.
I, you know, I love being athletic. Especially before I became a mama, like I was really like a go hard, like I like feeling like a beast. And so this
Yeah.
energy or notion of like, wait a second, I can't stretch my legs that far because I had like a clicking, like it would like something would
Uh-huh.
pop.
Uh-huh.
And yeah, it was just highly uncomfortable, but less the pain, but more so um the lack of confidence it gave me in being mobile.
Right. Right. And when you have fear of participating in things that you prior like enjoyed, it's really disheartening. And then you just kind of can go down this path mentally of like, well, what if I never get back to it? Well, what if
Oh
then I
yeah.
I never exercise again? And what if I never feel confident enough to go to a group fitness class again?
Yeah.
Or what if I can't, yeah, play with my kids? All of these things. And so you can start to get that dread and anxiety. And then, you know, I think body confidence is huge, and we already go through it, the most of it,
Yes.
with
Yes.
having to grow a baby and gain weight and have your breast change and your stomach and everything with feeding and delivery. So getting back to being able to do something that is good for your health and well-being mentally is huge. And I think that is a very common thing that I hear, that moms will come in and often are tearful at the first appointment with me because they're
Mm-hmm.
embarrassed and they are very discouraged, and they maybe even share with me an example of like, well, I tried, going back to CrossFit or jumping rope, or I'm trying to run this half marathon with my husband 2 months postpartum. I've had patients try to do that, and
Mm-hmm.
they're just so upset that their body isn't cooperating the way that they want it to.
Yeah.
And I have to, and that's what I love about PT is I'm able to show them, okay, there are all of these many thousands of movements that you can do right now, but
Mm-hmm.
your pelvic floor may not be able to handle what you're asking of your body, even though your legs and your arms and your heart feel fine. And
Mm-hmm.
so that can be
Mm-hmm.
really confusing to people because we're so out of touch with our pelvic
Mm-hmm.
floor muscles until we go through pregnancy and
Yeah.
delivery,
Yeah.
that when we're asked to then focus on them so much, it's like, wait, what? And where is
Mm-hmm.
that body part? And what does it do? And
Mm-hmm.
how can I strengthen it?
I remember being taught how to control the muscle, and I
Uh-huh.
was like, I didn't even know. Like, I remember the instructor asking me to do this, like this imagery with the tightening of the muscle, and I was like,
Yes.
I don't even know. Like, how do I know if I'm doing that right? Like, it
Right.
was just so
The mind
foreign.
muscle connection is so hard at first because we're not very connected to our vulvas and our vaginas. We're just not.
Yeah. Yeah. And we're not taught it. I wasn't taught about it in school,
Right.
in terms of like high school, college, like it was like, yeah, this is the anatomy, but we didn't go deep into it.
Hmm.
Yeah.
Yeah, it's true. So,
I
um,
want to ask Girly, just so that like in case mamas that are maybe getting ready to be a first time mom, or maybe they have multiples and they just never have done this for themselves, what are some of the most common issues that women face postpartum?
hmm.
And what should we be looking out for?
Yes, that's a great question. Some of the most common things that I see postpartum would be diastasis recti, which is that abdominal separation. 66% of women will get that,
And how do you
or will
know if
have
you
that
how do you
until
know
the
if you're
first year.
experiencing that? Sorry to
Okay,
interrupt.
so you can place two fingers horizontally on your abdomen at the umbilicus or belly button, and then you can lay on your back and do almost like a little crunch test where you try to lift your head and shoulders up off of your bed. If your
Okay.
fingers sink in those 2 centimeters, most likely you have some separation. You can also do the test about 2 inches above your belly button and 2 inches below. You may notice coning or doming when you're exercising, which would be like, a little cone of tissue when you're doing anything that
Mm.
involves abdominal contractions. So think more like sit up test, core exercises, maybe even getting up from bed in the morning, um,
Okay.
picking up a heavy child. You
And
may
so
notice that.
other than the cone, like I'm thinking about myself, like I have a pooch in my belly. Like I don't even know if I could feel like 2 inches without like just touching fat just to be frank,
No,
right?
well, yeah,
So
you have to push firm and you'll feel your fingers will sink. Like there's a little line there. If you press hard on your belly button and right above,
mm,
you'll feel a little, and it's almost a little tender if you're
okay.
right on the spot. At least I don't like people touching my belly button. It feels weird to me. Um,
So I
but
guess my
yeah,
question of well, I'm sorry, you finished, and I'm gonna ask my question. My apologies.
no, you're fine. So if you push and when you're doing the sit up test, they go further in. I think that's how
Okay.
you would know. Because, yes, you definitely are palpating through fat and skin and tissue. But,
Yeah.
and the pooch that everybody gets postpartum while belly is shrinking and everything, like that's different. That could be due to some deep core weakness. But it's different to have it go out only when you are exerting yourself, that coning and doming.
Mm. Okay, so if someone does have that, how does that show up in everyday life? Like, why is that a problem?
Low back pain is probably the number one thing. They'll have low back pain. It actually is very much correlated to stress, urinary incontinence, difficulty fully emptying the bowels, so maybe even constipation and hemorrhoids. Um, those would probably be the top complaints that I would hear associated with it, and just weakness. I mean, think about your core as the center of your body. So difficulty with the diaper changes and picking up my toddler, um and maybe, yeah,
Mm.
my abdominal muscles are not like my stomach. Everywhere else I'm gaining strength and I'm losing weight, but like I just have this huge pooch, and I'm strong everywhere else. Like, why is this happening?
Mm.
And so it can really be related to the deep core muscles. But
Mm.
yeah,
You know,
so diastasis is just one of the things postpartum, and 66% of women, their diastasis will come back to normal 1 year postpartum.
okay,
Everybody gets it pretty much if you carry a baby past 35 weeks. So
okay,
it is
okay.
inevitable because, our abdomen has to expand to hold. And for you, a 12-pound baby, oh my gosh, a huge baby. And then another postpartum complaint that I often have people come to me with is dyspareunia, which is painful intercourse, or pain with, yeah, deep or initial penetration, or even
Mm.
external touching of genitalia. So that is common. Involuntary loss of gas, stool, or urine, urinary urgency and
Hmm.
frequency,
That's
people
probably the
waking
most
up,
common, right?
yeah,
Like,
a lot in the
yeah.
middle of the night. Yeah, the bladder problems, definitely.
Mm.
And hormones, take years to balance back out for some. And especially if you're breastfeeding, they are not going right back to what they used to be immediately
Yeah.
postpartum.
Damn, you know what I'm thinking? Like the
Yeah.
women are just so incredibly resilient, beautifully complex. Like there's so much knowledge that you're bestowing upon us for pelvic floor health. And I'm just thinking in my own brain of like all the knowledge that I have when it comes to mental health
Yeah.
in the postpartum
Yeah.
realm. So it's like you're dealing with things physically, you're dealing with things emotionally, spiritually.
Hmm.
Like there's just so much evolution that happens for a mama postpartum. I mean, all of it.
Right.
But pregnancy, birth, postpartum, raising children, like there's just so much. So you're shedding light on so many things that are so important. Um, when I hear you talking about these potential issues, like I think about myself and I think about women in general who so yeah, like you were talking about that defeating thought of like, well, I guess this is just how it's gonna be. Like,
Yeah.
like I'll never get my body back to what it was. And I don't even mean in a sense of like weight or shape, which is important too, but
Yeah.
more so like that feeling of confidence of like, well,
Yes.
I just must be getting older, and this is what happens after you have kids, right?
Mhm.
I guess like how much of that is true, and what advice do you have for women that feel that way?
Yeah, that's something I get a lot is I'm dealing with a symptom. Like, I have to really dig sometimes to ask about bowel and bladder questions, because maybe someone is just coming to see me for some postpartum low back pain. And then in that conversation, I always ask about bowels, bladder, and sexual health, because I know that they all intertwine. And so they may say, well, I just leak, but it's like, when I
Not a
cough
big
and
deal.
sneeze, yeah, it's not a big deal.
Mm,
And it's,
yeah.
I had three babies, and it's just when I cough and sneeze, but then I start to ask more questions like, what about if you get up from a chair? What about if you squat? What about if you pick up that case of waters off the floor? What about if you were
Mm,
to run? Oh, I don't run anymore because I can't. I mean, if I'm leaking when I cough and sneeze, okay, do you want to get back to running?
mm,
Is this a big deal for you? Or prolapse? I feel like prolapse is um, is a word that a lot of people don't know a lot about.
yeah, I was gonna
And
say, what is that?
yeah, so pelvic organ prolapse is when an organ, it could be the rectum, the uterus, the bladder, all three, is basically descending. There's some laxity in those organs, and it's because of ligaments that uphold them. We also have muscles that support them, our pelvic floor muscles. But when they are pushing into the vaginal canal,
Mhm.
people can have a lot of issues. So a rectocele is when the rectum pushes into the vaginal canal. You can have a cystocele. Um, but whenever people feel prolapse, I guess the best way I could explain the sensation is, you know how after birth your bottom just feels heavy? It's sore, achy, there's pressure.
Mhm.
So that feeling, some people don't have it go away completely. And if you don't have it go away
Mm.
completely, or it comes back if you've been on your feet for a long time, or you feel it only after you run, or you feel it maybe after sexual intercourse, after activities that cause increased blood flow and heaviness, or maybe during your menstrual cycle. That's why
Mm.
pelvic floor PT can actually help people that have really painful periods because the uterus
Mm.
is filling with blood. There's more weight, and that can contribute to pain if your
Mm.
muscles either A, don't have the mobility to contract and relax fully, or two, maybe they don't have the endurance and strength to hold everything up nice and high. So
Mm.
prolapse is very common, especially after vaginal births. And it is
Mm.
very treatable, but a lot of people don't know about it. And I actually heard recently that I think it was in France or Italy, a European country, that they are automatically sending women, all women postpartum, to pelvic floor PT, and
Yeah.
they fit them with pessaries, which, if you don't know what a pessary is, it's like the best way I can explain it is it's kind of like a retainer for your vagina. So
Mm.
it's kind of similar to what a NuvaRing looks like, that birth control,
Okay.
but it's worn right below the cervix, or it depends on what organ, I should say, is prolapsing. And they could be cube shaped, donut shaped. They come in different shapes and
Mm.
sizes. They're fitted to your body, and they help to provide some support. And
Oh,
you can wear them
interesting.
while rehabilitating your muscles to provide
Wow.
more support.
Hey, mamas, let me ask you this. Do you dream of starting your own business but feel overwhelmed by where to begin? You're not alone, and that's exactly why I created our free WhatsApp group, Balancing Business and Babies, a safe space for moms like you who are ready to take that first step towards entrepreneurship while balancing the beautiful chaos of motherhood. Inside, you'll find daily mindset shifts and tips, encouragement from women on the same journey, and bi weekly free community calls. Whether you are still in the dreaming phase or ready to take action, this group is here to support you every step of the way. And the best part? It's totally free. Just click the link in the show notes below to join. Mama, your dreams are very much possible, and you don't have to do it alone. Let's build your vision together, and I'll see you in the group inside. Thank you for answering that question. I think hopefully that gets a lot of mamas that are listening in just contemplating, like, yes, I should, should I go see a pelvic floor specialist? And like, yes, probably so.
Yeah.
Probably
I
so.
think everybody should be seen by a pelvic floor PT if you've had a baby. I know that's like maybe shocking for some people to hear. I honestly, uh, being one myself, I would recommend that you go see one for birth prep. Whether you plan on
Yeah.
having a C-section or a vaginal delivery, because we all know that plans don't always go how you want them. And a lot of the issues that I see people for, I feel like it's 9 times out of 10, they will have had the mild symptoms of it during pregnancy. So how much,
Mm.
prevention could we have uh,
Yes.
gained if they would have seen
Yeah.
me? And it's really helpful for the therapist, honestly, to be able to assess your muscles before and after. So I can know, like, okay, this is what we're trying to get back to,
Mm.
or stronger.
Yeah. Yeah. Yeah, I'm all about support. Like I'm thinking about my you're literally rejogging my memory. It's in the far distant past, but it was 2 years ago. Yeah, like I had so much support that educated me on these things, and I think that was so helpful.
Hmm.
I had a doula, I had a midwife,
Oh
and
yeah.
yeah, they would educate me on all of these things and provide. And that's interesting. Like I'm wondering, I'm like, does this overlap, right? Like what they advised me to do versus like because I did go to a pelvic floor specialist afterwards. Not too many sessions to be frank, but it was helpful. But I think that all of my work, like what you're saying before I delivered, was really helpful to my overall
Yes.
health.
Yes.
Um, and just the education piece, right? Like that's usually what we're missing and what we can't fix what we don't know.
Correct. Yeah, for sure.
Yeah. All right, girly. Well, this was super, super informative. Thank you for giving us all of your knowledge. Anything else that you think is really, really important that women should know about their pelvic health? Um, what would you say for that?
So I feel like a lot of people have fear about coming to pelvic floor PT and especially the vaginal assessment, that component of the exam. But one thing that I'm finding over the years is that when you teach someone their anatomy, like when they truly know the muscles, the ligaments, the bones involved, they are one able to reconnect to that body part a lot better, which actually has a lot of benefit psychologically if there is pain with intercourse or a history of sexual abuse or trauma. It can be really helpful to connect to that body part in a healthy way. And so secondly, after the educational component, it it becomes helpful for
Mm,
you to know, okay, I am capable of contracting and relaxing these muscles. I do have control over contracting them and relaxing them. Because some people, especially my pain patients, they're coming to see me and there's a lot of guarding and muscle tension and trigger points. And
mm,
teaching them, hey, this is how you gently relax and maybe even
release.
gently bear
Mm,
down through your pelvic floor muscles to allow things to enter without pain. Or this is how
mm.
we contract and tighten
Oh,
our
that makes so much
muscles.
sense.
And this is how we
Mm.
time it whenever we're coughing and sneezing. And we want to make this
Oh.
contraction milliseconds. It should happen milliseconds before the sneeze in a normal, healthy
Mm.
body, right? But what's common isn't always
Oh.
normal. And I think that's the biggest thing that I'm trying to preach to people is and if you don't feel heard by your OBGYN, by your midwife, by your GI specialist, if you've been to numerous
Mm.
people, we are some of the only practitioners that have a manual muscle testing that grade your strength, your endurance, your quick twitch
Mm.
fibers, like how fast you're able to coordinate those contractions. And if you think about it, when you go to an OBGYN, what are they doing? They're checking for the big scary red flag things, which is great. They're doing pap
Mm.
smears. They're making sure you don't have cancer. Um,
Mhm.
they're making sure that sutures are healed,
Right, right, right.
or are doing their job if you have had a repair postpartum. But I went to my checkup 1 and 6 weeks out, which I loved where I delivered. I had great prenatal care. And I remember asking at my 6 week visit, are you going to do an internal assessment? Because they were like,
Mhm.
you're good. And they were wrapping up, I could tell. And they were like, we can if you want. And I just thought, wow,
Mhm.
so if I didn't ask for this,
They
I
wouldn't
wouldn't
have
have
done it.
gotten
Yeah,
it.
they didn't they yeah,
And
interesting.
they weren't checking my strength and endurance and
No, none of
all of
that.
the
No.
mobility. They were just
Yeah.
making sure that there was nothing that needed to be sutured, really.
You know what? I'm literally thinking about my own experience and I'm lucky that they did make the referral to go
Yeah.
see a pelvic floor specialist, but I'm thinking, for even for myself being in the medical world at one point, like it can be so overwhelming and confusing to
Mhm.
know what every single person does because you're illuminating light on this for me in real time now of like people don't understand that like yes the OBGYN is extremely helpful but yes they're looking at big problems like
Yeah.
they're overseeing things and they're not going to look at the minor details that would be very helpful in your day-to-day life concerning your pelvic health, right? They're like, okay, like yes, like there's no major scars here. You're not having any, like I mean, I don't even know. I'm not a doctor in that sense, but there, I think it's so important to know that like myself, I had the doctors, the midwife, the doula, and even all of their knowledge combined was super helpful, but
Right.
still not the knowledge of what a pelvic floor specialist has.
Right. And at 6 weeks postpartum, what have you probably not done yet? Well, if you listened, you haven't had sex yet, and you probably haven't exercised because you're exhausted and you don't even know where to begin, and you've been waiting for that checkup. So now you're told,
Mm,
okay, you're good to go, return to all the things. And then that's the
with
time in
all
your
these
life where you have
problems.
nobody that you're seeing anymore. There's no one over your case.
Yeah.
You're
Yeah.
discharged. Like they did their job. Their job is to
Wow.
watch you during pregnancy to get you and baby, you know, healthy, and then
Yes.
to deliver your child. And then
Figure it out.
they're
Figure
done.
out the rest. Yeah.
Yeah.
I'm just thinking about all the things that you shared, and like, I'm just excited for you, girly. I'm excited that people have an opportunity for you to be more hands-on, to
Yeah.
have more nurturance with them, have more time with them. Like,
Yes.
I know, in my experience of being a patient of, um, having a doula and a midwife, I went to the midwife's house, from like month 4 to 9 of my pregnancy, and like she saw me
Mm-hmm.
there, and
Yeah.
just having like that more intimate connection, longer sessions than
Right.
just that 15-minute in and out kind of thing at the
Yes.
hospital. Like, and this is something that is it's just another layer of importance that frankly I don't think enough of us are educated on. Like, I'm thinking even about myself, like, thank God I did go ahead and see one afterwards, but I didn't even understand the importance of all of that until now from all that you're sharing with me.
Right. Yeah. And that's why I want to make things more accessible, because I get it. It's a very overwhelming time period too,
Yeah.
whether you're pregnant or postpartum. Think of all the appointments you have during
Yes.
pregnancy. You don't
Yes.
really want to add another. I get
Yeah.
it.
Yeah.
And especially postpartum, if you have other children, and it's a lot of work to leave your house. And I felt that.
Mhm.
So knowing what I know,
Right.
I wanted to go and see a friend who was a therapist. I drove an hour to get pelvic PT for myself,
Mhm.
for about 4 to 5 sessions postpartum. But I'll be honest, like I dreaded the appointments because I had a newborn that was
Mhm.
crying in the car,
Mhm.
and I remember having to nurse in the middle of sessions. I had so much brain fog at that time. I wasn't able to really focus on what she was saying, because, your ears
Mhm.
just hear your child
Yeah.
crying,
Yeah.
and you see them doing the feeding cues, or you smell that they need a diaper
Mhm.
change. And so I'm like half paying attention. And so that's one of my reasons why I wanted to make pelvic PT more accessible for moms.
I love
So
that.
offering in-home services, even if they're wanting to come to my home or me come to theirs, or
Mhm.
telehealth after they've had that in-person pelvic floor muscle assessment, preferably to
Mhm.
begin telehealth, because I think that it feels very overwhelming, and I don't want pelvic PT, because it's already can be a scary thing to have someone, examining all of those problems, very intimate problems, to also have to make time out of their week to arrange childcare. So like I'm like, yeah, let your baby nap. Let me come over during nap time. You want to do it on Saturday mornings when your husband's home? I'm flexible. You want to
Mhm.
do it in the evening? Like I'm very flexible. Because I had a lactation consultant that came to my home on a Sunday
So
evening.
helpful.
Yeah,
Yes.
when my baby was
Yes.
not latching well anymore after being
Yes.
discharged, I had a lactation consultant that came over, when I was in a panic about to return to work and needed to figure out how to work my
Wow.
pump. And I loved it. And we're still friends to this day. And
Mhm.
shout out to Ashley River Lactation Consultant Company. But yeah, so I
Wow.
appreciated that. And I didn't even know that was a thing. I remember when my midwife told me, like, you can have a lactation consultant come to your house. I was like, oh,
Yes.
like, is that extra? And she's like, no, that's like, she always goes to people's homes. And
Yes.
that's just how their business model is. And I remember thinking,
Yes.
how great.
Amazing. Yes.
Yes,
Yeah, and
amazing.
it was, yeah, me too. You're making me like literally like the postpartum phase is such a fog for me. But yes, I remember with my son Marcus, my firstborn, I had to go to lactation consultant at the hospital, which
Uh-huh.
was helpful, but oh my God,
Right.
was that so stressful? Getting
Yeah,
them,
to
in
get
the
there.
car, all the, all the things. And then yes, with my daughter, I went the more holistic route. And I also understand like the privilege that comes with that, because a lot of that
Right.
had to come out of pocket, you know.
Yeah.
But I will say, like, now that you're kind of rejogging my memory, it's like, wow, like I really did have a very nurtured postpartum experience, but it was primarily because I was working with business owners,
Right.
small business
Right.
owners. I
Right.
wasn't working with big clinics, big hospitals, right?
Right.
I had my doula and midwife see me like up until 2 months postpartum. They would give me like
Mm,
biweekly check-ins, monthly
that's
check-ins until we
awesome.
like tampered off. Yeah.
That is
And
so rare. Yeah.
yes, and then we also had yes, a lactation consultant come. I think she gave me 4 to 6 sessions, something like that. And yes,
Mm,
like if I was still in Charlotte, we'd probably still be friends. Like she
yeah.
was, I mean, it's so intimate. Like you feel like you're failing, your baby can't latch. It's like all these hard things. And this is she was a mother, but even if she wasn't, like just a woman who is helping you through such a hard time of the postpartum experience. Now I'm thinking you as, a pelvic floor specialist coming in, like just what a blessing to be able to take that alleviation off of mamas, that this is one less thing that I have to go out for.
Right. Yeah. That's what my prayer is. I want to provide like a safe space, judgment free, and I want to allow women to be able to ask all the questions, to demystify their pelvic floor. What is it? And to just be their partner and guide them through that rehab process,
Yeah.
and just be encouraging, because I think it can be discouraging to try something and then to for your body to fail you, even though
Yeah.
you
That's what it
mentally
feels like.
are there.
Yeah.
Yeah, yeah, it
Mhm.
feels like that very much so. And
Yeah.
I think the cost is very daunting, like you mentioned, like to be paying out of pocket, but you truly do
It's so
get what you
worth
pay
it.
for, and
It's
it
so
is so
worth it.
worth it. And I tell
Yes.
people, for you to spend $1,000 on pelvic floor rehabilitation, to not have pain when you have sex with your
Mhm.
spouse, to not
Mhm.
have leakage when you exercise or when you laugh, to not be dealing with constipation and hemorrhoids and bloating and calling out of work due to menstrual cramps and painful periods. Like
Just a better
that
quality
is,
of life. A better
yes.
quality of
How much
life.
are
Yeah.
people like? People are paying for massages and
Yes.
nails, and we're paying
Yes.
over $100 a pop for those
Yes.
things. So it's
Yes.
like you, it's just unfortunate that Americans, we really don't value
Mm-mm.
our
I
health
just
as
don't think
much as we
I
should.
don't think we're well educated in that sense.
Right, right. We don't know
Generally
the
speaking,
value
don't
of it because
know.
we're not taught about it. Yeah, about these
Yeah.
different fields for sure.
Yeah. Wow. What a beautiful conversation, girly. Okay. I learned so much, and you also rejogged my memory. And I know that mama's listening in, I'm sure, from the business aspect to, I think more importantly, all the education that you gave us over what we should be looking out for, what is
Mhm.
common. I really hope this encourages mamas to, yes, see a pelvic floor specialist if you need care, which you probably do. You definitely do if you're
Yep.
postpartum, or even prenatal. So, all right, girly, now it's time to get intimate, which is my favorite part of the episode. I am biased. Um, Tell us about something that you have been struggling with. I'll say this before you share. I've loved getting to know you as a neighbor. I think that from what I'm learning about you, you're so ambitious. You have a lot of passion. You mentioned before that you're a perfectionist. And so, I can see that you like to have a lot of, healthy amounts of control in what you want to do. And like you're using that to your power to build this business that is
Mhm.
going to help so many people. So I am a fan of yours. I'm applauding you. I'm so happy to know you. And I reserve this portion of the podcast always just to get real and intimate, because from the outside looking in, someone could see you, us, anyone on my show of like, wow, like they have it all together. Like
Right.
they're doing, and yes, like we're doing amazing and we're also still real human beings. So anything that comes to light, what could I hold space for you for that is giving you maybe some trouble, or you fill in the blank, really. I'll let you talk first.
Yeah, I feel like I think of two things automatically. Just I guess the mom guilt of like, okay, because my for those of you who don't know, yeah, my husband allowed me to start working PRN, and so that enabled me to have this time to start my own company.
What
And
is PRN for those that don't know?
so PRN work is just kind of as needed. So you'll work at for me, a PT facility as needed. You're not guaranteed your hours. So it's usually less than 20 hours a week. But some people can not guarantee you 40. But yeah, I'm working like 16 hours a week right now, in addition to doing my own practice. And so with that, my husband and I did not grow up, excuse me, in families where we have people that run businesses. Like we don't know anybody close to us that owns a company. And
Mm,
so his fear was, we're finally able to give you this time where you don't have to work as much. And now I'm fearful that you're filling in all of this
mm,
open space,
mm,
and it's going to take away time from Gabriel, which is already, mom guilt. We all don't want to not be present enough with our children. And so I
yeah.
think it's been really hard because I feel like I need to both
Mm,
prove to myself that it can thrive and that I can eventually quit this PRN work. But
mm,
also to my spouse, which I know he's going to be like he's supportive, and he's going to be happy whether I see 4 patients a week or I build up to seeing 20. Like he
mhm,
is super supportive, but I think we both have some fears about, what if all of this time spent is for naught? So that's been something. And then just, yeah, the body image changes with postpartum. Like I never, which I'm blessed to say this, I really genuinely never struggled with feeling like, oh, I don't like what I see in the mirror. And I have struggled with that since
mm,
having a baby. It's been very challenging for me to have to confront that. Um, and I lost too much weight breastfeeding, being sick for 5 months with my son while he was in and out of daycare because of sicknesses, and just your boobs
mm,
changing with breastfeeding, and um, just loss of muscle. Like I used to be very strong, and just feeling like this
mm,
fragile,
mm,
weak weaker woman, um, has
mm.
been challenging for me.
Yeah, wow. Thank you for sharing that, girly. All right, so let me go to the first one. So I think it's beautiful that your husband supports you, and it just seems like he wants what's best for the baby, which is beautiful,
Yes.
right?
Yes.
Like more time with Gabriel, like yes, like, and I also feel like probably you can correct me if I'm wrong, like probably just like as a man, it feels also really good that he's able to provide in a way where you are able to
100%.
go from full-time to part-time, right? Or
Yes.
PRN. And humans are beautifully complex, and so you have his role of husband, supporter, father, worker, right? And like there's just these different glimpses coming out of him when he's talking. You too, right?
Hmm.
And I'm an advocate for all people, but yes, especially mothers, women. And there's something so healthy about going back to a passion, right? And but also you became a mother, so you were passionate about your work, and then you had a baby and you're like, wait a second, I don't want to be this stressed all the time. I want
Right.
to see my baby more, but I don't want to give up my career,
Right. Right.
right? And everyone's path is different, but in our case, right, it's like, no, we really love what we do, and
Hmm.
this brings a lot of happiness to my heart. I just don't want it to feel as stressful.
Yeah, for sure.
And the entrepreneurship side of it is like, yeah, and I'm also seeing a vision that is giving me a lot of excitement and passion of like, I could really be a change, a ripple effect in this field, at least for my community,
Hmm.
right? At the very least. And who knows what it'll turn into in the future, you know?
Exactly.
But I think fear is a very it can be crippling,
Hmm.
right? And you and I have spoken, off camera before of like how my true belief is that like entrepreneurship is really a mental game.
Yeah, for
um
sure.
and that fear in anything in particular, but we'll keep it on business because that's what's coming up for you guys, is that, yeah, like we don't have any examples of this. How do we know
Hmm.
it's going to work? And the fear of like, am I taking away time from my son?
Right.
you know um what I would say to that is I can feel the excitement and the passion, and just getting to know who you are as a person. I would think that you're heavily considering your son in all the things that you do.
Oh, for sure.
And
Yeah.
so even though, like, yes, maybe sometimes like you're questioning, like nothing is ever perfect and you're learning along the way, and you won't have anything perfect until you try,
Mm.
right? And so you're trying right now and you're gaining momentum, and I know you'll be successful, but let's just say worst case scenario, even if it doesn't work out, and it will. So I don't even know why I'm saying that. Um, um, but this is still something, results aside, you taking a leap of faith in doing something like this is good for your emotional and mental health.
Mm.
And
Mm.
it's good for Gabe. It's
Yeah.
good for the
Yeah.
baby,
Yeah.
right? To have mommy that is happy about something, that is able to come back to baby and be like, oh my God, I got my first client,
Right.
or
Right.
like, oh my God, like,
Right.
I, selfishly, egoically always say that like my business literally makes me a better mother.
Yeah.
I'm happy doing what I do. Like,
I
look, I get
believe
to do
it.
things like
Yeah.
this. Like, this is such a cool part of my entrepreneurship experience, and I love it. And then I get to go back to my kids and be fully present because
Right.
in my mind and in my journey, yes, it strokes my ego to be of service. I like that. I have passion for it, and I have no problem admitting that, And so if that makes me a happier person, that I feel that I'm in control. I heard the perfectionist thing in there, that I'm in control of my hours, I'm in control of how I serve people, I'm in control of how this goes, and I get to make money off of it, and I get to provide to my household income, right?
Hmm.
And I still get to be your stereotypical stay-at-home mom who's literally with her kids all day. It's like
Right.
none of this would have come to be if I didn't, just like you are, literally, I took the leap of faith when I was pregnant with Marcus. So just
Mm.
right before you,
Yeah. Yeah.
right? Not knowing if it was going to work. But I figured I'm like, we just have to try. And
Mm.
you and I are also similar in the fact, just another example for people to listen into. Like, we've both moved from our hometown,
Yes. Yes. So
right?
less connections here.
That
Yeah.
was also a leap of
Yeah.
faith. And
Right.
people always say, like, if it doesn't work out, you can just go back. God
Right.
forbid, if this doesn't work out, you have a degree. You can
Right.
always go back to
Exactly.
work,
Exactly.
but you don't know if you don't try. And
Mm.
I want to applaud you both because I know that his intentions are pure. I know you know that too,
Right.
right?
For
Like he's
sure.
just he wants you to not work yourself out and burn yourself out
Yes.
because he
Yes.
loves you. And
Yes.
he's like, damn, like, like I am making enough money where I'm able to do this thing for the betterment of our son. I want to
Right.
take advantage of that too.
Right. Right.
All
For sure.
valid.
Yeah, he just wants me to rest more. I know that is
Yeah.
his. He knows I'm so type A. And those of you that know Gary, he's the chillest. So we balance each other well.
Yeah, I love it. And as far as the the personal body image,
Mhm.
that is something that I'm still struggling with, to be frank, heavily. And this morning as I was getting prepared for this interview, I was putting on my makeup, doing my hair, and I'm grateful for the moments of clarity that I do have, even
Mm.
though I'm in a much bigger body, and I'm doing my part now more than ever to like really be conscious of my health.
Yeah.
But I've definitely had those moments of like giving up. Like my body is so foreign to what it used to be.
Right.
um it's crippling sometimes, like the mental defeating thoughts. So I'm just sharing that as advice, but like as a sister, like I get it.
Yeah.
It's heavy, but I will say, like, this morning when I was doing my makeup, it was just, looking at myself in the mirror and honoring like me to me, you're doing so much,
Mm.
and not everything is perfect, and it doesn't mean that I should give up or that we should give up. If anything, our conversation today really like made me like give me a push of like take care of yourself, it's
Yeah.
so worth it.
Mhm.
But yeah, those glimpses and moments of me being able to look at myself and love
Mhm.
myself, not because of what I look like, but because of what I feel inside.
Yeah. Yeah. And I have to just remember to have gratitude for the ability to carry a life, to bring life into the world, to be, for, I'm religious, to allow, for God to allow me to be a vessel for new life
Yes.
is a beautiful
Yes.
thing.
Yes.
And so just remembering that this body, it goes from dust to dust, and no one's going to remember the vanity of it all. They're going to
Yeah.
remember what kind of mom we were, what kind of friend
Yeah.
we were, what
Yeah.
kind of provider we were to them, those types of things. And
Yeah.
so even though it can feel so big when you look in the mirror, knowing that like it's really not that important.
Yeah. Yeah.
Yeah.
Well, I love this conversation, girly. Thank you for allowing us to see a more vulnerable side of you. As a neighbor and a friend, I definitely love you more for it.
Oh,
I know our
you're the
listeners.
best.
I know our listeners are taking so much away from this conversation. So I thank you for joining us today, girly. Um, what is the best way that people can reach out to you, learn more about you, and connect with you?
Yeah, so I have a website with a contact form. It's www.pelvicflorespt.com. And then you can text me at 423-509-2003. And then you can follow me on Instagram or TikTok, and it's at Pelvic Flores. So
Beautiful.
yeah.
Yes, all those links will be in our show notes below, so you can just give that a click and find Dr. Caitlyn and hopefully make your postpartum or prenatal journeys that so much better.
Yeah.
All right, girly. Well, thank you so much.
Thanks
What a
for having
beautiful,
me. I really do appreciate this opportunity. I was very
of
excited. I was like,
course.
"Ooh, my first podcast."
Yeah, you killed it. It was super educational, super
Yeah,
heartfelt. I think people are going to get to see like this beautiful passion that lives within inside of you, and it makes a difference when you love what you do.
yeah,
You're better at your job when you do, right? So this was a beautiful conversation. Thank you for joining us, and yeah, that's all for now.
yeah. Thanks.
So welcome. Thank you for joining me today on Mindset Mastery Podcast. I hope today's conversation inspired you to embrace your own journey of balancing motherhood and entrepreneurship. Remember, it's all about mastering your mindset to create a life of success and fulfillment in both areas. If you enjoyed this episode, don't forget to subscribe, share it with a friend, and leave a review. Your support helps us reach more incredible moms just like you. Until next time, keep showing up, keep growing, and mastering your mindset.